kids can be one of life's most rewarding experiences. But if you've got kids, you've got to have a great pediatrician. Or better yet, a team of doctors to help your kids with their sniffles and coughs and fevers and bumps and bruises they're sure to experience as they grow. Well, we're going to introduce you to one such team of doctors today. Hi, I'm Janice Marie with Close Up on America's Business, and today we're in Wayne, New Jersey, visiting Pediatric Professional Associates. This is a highly talented group of doctors that offers more services under one roof than any other practice in the area. They've been keeping kids and families healthy for over 40 years.
We're a pediatric medical group. We provide medical care to children and adolescents, actually from 0 through age 22. It's actually through 21. When they turn 22, they have to move over to an internist or a general family practitioner to complete medical services, sickness, health, everything that a pediatrician does. We're all general pediatricians. We have a support staff of nurses, receptionists, lab technicians, and of course administrative staff.
When I had my first set of twins, we were going for our well visits and we were seeing a physician that was associated with the hospital where I had the babies. In coming home from one of the well visits, we found that Amanda had experienced a problem with her eye, which was not a good situation considering we're coming from a doctor's office. Didn't know where to go, but I had remembered someone had said someone was right down the street from us. We decided, let's stop there, see if they will see her. Sure enough, we came here and they told us just bring her right in. Took a look at her right away and found that there were a lot of other tests that were not done that should have been done on the first set of twins. So since then we've been coming.
Our commitment here is to offer the best possible care that we are capable of giving to the child and the families. We have a big advantage being here in the complex because, as you know, children do get a lot of injuries. They do break their arms. And we have a radiology service right around the corner in the building. Parents bring their children here because we offer excellent care. And the families do know it. We also are available every day of the year, including holidays and Sundays. And evening hours are offered to the parents who are working. So these are big advantages. And of course, we are all excellent physicians. We are always available to the public. They will have a choice of a physician as long as the physician is in this office, since we have 3 offices.
Beyond medical care, I think the important thing that we do is giving a lot of comfort to the child and the family, especially parents when they're nervous when their children are sick, just to offer that level of self-assurance to the parent when they're nervous, especially new mothers when they come in. They're very anxious a lot of times. A lot of times, most things are normal and the kid's going to be okay, but offering that reassurance, just following the kids as they grow, and you get to know the families, and it just is comfort when you have that rapport with the families and the children.
This practice has been around for a long time, since the mid-1960s. To what do you attribute that kind of success?
I think the key to the success of the practice has been the continuity of the doctors that have been here a long time. Supporting staff that we have also been here a long time. They know their job well. Why are you here today? What's going on?
I'm sick.
Have you been coughing?
Yeah.
And a stuffy nose too?
Yeah.
Any fever at all?
No.
No, okay. Does anything hurt?
No.
No, okay. Well, I'm just going to check you out, okay? All right.
The reason pediatric is so rewarding is because you get to see the kids right from birth grow into adulthood. And some of them come back with their own children, and this is just a wonderful experience. The other good thing is you get to work with the parents just like a team. In the past, it used to be you go to the doctor, they examine the child, here it is, here's your diagnosis, here's your prescription, you go home. Nowadays, parents are much more informed with the help of internet and available information. They have a lot of questions. They want to know, is this the right decision for their child? And it's not the same right decision for every family.
We were both patients here, and now we're parents, and we feel very comfortable because we know the treatment that we received as children and the warmth that the whole office has, and the doctor's care, that we feel comfortable bringing our own children here now to 20-something years later, and it still holds such a high standard.
This practice has been great to work with. I'm very excited to be here and be a part of it. The doctors have been phenomenal. I love the way that they do care for their patients. It is great to see the enthusiasm of the parents and their love for all of my doctors here. My staff has been here for many years, and I think that really shows the caring of the doctors and the patients, that everybody here really enjoys what they do and being part of a good team. And I am very proud to be part of it.
You never feel uncomfortable asking any questions, and if I have to come down here with my twins, I'm very comfortable because I know someone will help me even from the car into the office if I need it. They're like family. When we come here, we've been here for years, my husband and I. I used to see Dr. Topchak, and now we see Dr. Charles, who puts us at complete ease as soon as we walk in the office. My son, who's 3, imitates Dr. Charles, constantly is pretending he's a doctor, and her famous words when she's approaching him is, "Okay, lovey," and I see him doing that to my son, and they don't mind coming here. Even though they know they're going to get shots even, they're willing to come and say, "Let's go to Dr. Charles," and they're like, "Okay," they like coming, they don't mind. There's tears when there's shots, but still they'll thank Dr. Charles, and they love getting their stickers, and they know where they're capped, and they're very comfortable being here.
Tell me which ear hurts? Where's the boo-boo? That one? Okay. I think the problem that parents are most worried about, as far as the doctor's concerned, is that they won't have enough time to communicate with the doctor, to ask the questions that they want. The last thing they want to do is be rushed in and rushed out. You hear and read a lot about that being done in medicine today because of the high volume that is required to be seen by the doctors. We do give the patients that time, and after a while, that's exactly what the patients see is being provided in this practice.
Well, that's Pediatric Professional Associates, convenient locations and hours so that parents can get their kids here for the health care they need. A whole host of services right under one roof. And most importantly, a talented team of doctors that's committed to keeping kids and families healthy as they grow. Reporting for Close Up on America's Business in Wayne, New Jersey, I'm Janice Marie.